Coordinating Minister of Health, Professor Pate, endorses diaspora insurance scheme.
This is important. It's fixing a key pillar of the health transformation that Nigeria needed.
Renewed Hope Initiative distributes 10,000 professional kits to midwives in northeast Nigeria.
As an incentive to encourage and support the tireless dedication of our midwives.
Nigeria Hydrological Services Agency predicts widespread flooding across the country.
Lagos, Ogun, Rivers, and Ondo are to experience coastal flooding.
And then good morning, Nigeria. Today we will focus on maternal health and well-being.
Well, it is Safe Motherhood Day, and around the world, conversations like this are happening about mothers, babies, and the care that keeps them alive and thriving.
And rightly so, Victor, because while bringing life into the world should be a moment of joy for many women, especially in low and middle income countries, it's still a risky journey.
And the numbers are sobering. But the message today is one of hope, raising awareness, pushing for better access to care, and championing the kind of support that ensures every woman survives pregnancy and childbirth.
That means more than just having a baby safely. It's about skilled birth attendants, proper antenatal visits, emergency care when things go wrong, and postpartum support for mothers finding their feet again.
Progress has been made, I must say, but challenges still lurk. Limited access to healthcare, cultural beliefs, and delay in treatment, and of course, the financial burdens.
Which is why Safe Motherhood Day is a call to action, honestly, for government, for healthcare providers, for men, for husbands, for fathers, and yes, even for you and me to invest, educate, and advocate for women's health.
That's because when mothers survive, families thrive.
True.
And today on Good Morning Nigeria, we are taking time out to discuss maternal health. Not just the challenges, but inspiring stories and the solutions making a difference.
I like that line. When mothers survive, families thrive. What about fathers?
Well, I'm also looking forward to a day when we discuss safe fatherhood.
Oh, well,
There's
there's nothing to be safe
moment.
about, when it comes to fatherhood. You're safe already. Well, everyday women face unimaginable risk just to bring life into the world, but there are success stories too. Innovations, policies, and voices rising up to change the narrative. And of course, what the First Lady is doing, trying to equip midwives just to ensure that when women are taken care of or attended to at a point of birth, the right equipment is available.
So what does it take to make motherhood safe for all? You'll have to stay with us as we unpack it all. From expert insights to real-life experiences, we have it all here. And I am Victor, as we are watching Good Morning Nigeria.
And I'm Yanray John. It's great to have you join us again today. We're reaching you live on the network service of the NTA. We're right here at our headquarters in Abuja. You know what to say, you can't beat the rich.
Indeed. And still to come, Chukwudi Okoliubaja joins us for the newspaper review. I've seen him this morning, I think. I heard his voice too. But first, Yanray.
Talking about Chukwudi, he seems to be in high spirit this Friday morning.
He did something unusual today.
Okay. Anyways, we'll get to see all of that much later. But for now, let's get serious with the morning news. We've got Musa Abubakar ready to deliver that. Musa, good morning to you.
Good morning to the both of you. Here's the news. The Coordinator Minister of Health and Social Welfare, Professor Muhammad Alipati, has expressed support for the Diaspora Health Insurance Scheme. This initiative aims to expand access to affordable health care through strategic partnerships, mobilizing resources from abroad to support families back home. The scheme is expected to ease the financial burden of healthcare access and improve overall health outcomes by increasing access to healthcare coverage. The initiative promotes universal health access. Additionally, it encourages diaspora investment in local capacity building, including pharmaceutical plants and diagnostic infrastructure. The Diaspora Health Insurance Scheme is part of President Bola Ahmed Tinubu's administration's efforts to strengthen Nigeria's health system. The government is driving bold reforms to improve healthcare access and quality through strategic partnerships and diaspora engagement.
At least in terms of affordability, in terms of risk pooling, prepayment mechanisms, and our ability to buy quality healthcare.
Building on efforts to strengthen Nigeria's healthcare system, Renewed Hope has distributed 10,000 professional kits to frontline midwives in the Northeast Zone. This initiative, launched by Nigeria's First Lady Oluremi Tinubu in Jalingo, Taraba State, aims to reduce child and maternal mortality rates by equipping midwives with essential tools and resources.
The Renewed Hope Initiative, RHI, procured 60,000 branded scrubs and 60,000 pairs of Crocs as an incentive to encourage and support the tireless dedication of our midwives.
Following efforts to improve healthcare and nutrition, Nigeria's livestock sector is poised for transformation. The first Northern Nigeria Livestock Development Summit, held in Abuja, emphasizes adopting modern livestock techniques to boost food and nutritional value, aligning with global best practices.
For the North in general to come up with a strong policy, a strong communication on how this ministry will move forward and benefit us.
How to improve this practice to modern livestock practice.
As Nigeria focuses on boosting food production and livestock development, another critical challenge looms: flooding. The Nigeria Hydrological Services Agency has predicted widespread flooding across nearly all parts of the country, citing anticipated heavy rainfall during the upcoming rainy season. This forecast follows an earlier warning from the Nigeria Meteorological Agency about an early start to the rainy season.
Delta, Lagos, Ogun, Rivers, and Ondo are to experience coastal flooding due to the rising in sea level and tidal surge to impact on fishing, wildlife habitation, and river navigation.
In the recent development, a Port Harcourt-based lawyer's attempt to remove Vice Admiral Ibok Ete Ekwe Ibaz as Rivers State's sole administrator has stalled. The legal practitioner's suit filed at the Federal High Court in Abuja seeks to annul Ibaz's appointment through legal mechanisms, citing grounds for removal. However, respondents have yet to file responses, prompting an adjournment of the matter to June 11, 2025. The court's decision will significantly impact the state's governance and development. Well, those are the highlights of the news at this time. Good Morning Nigeria continues shortly.
I am Oluremi Tinubu, the global and national Stop TB champion. Many people have asked why I've chosen to champion the fight against a disease like tuberculosis. My reason stems from a deep personal experience. I once had a friend who unfortunately fell ill and concealed the nature of his sickness until it was too late. Eventually, after he passed, we discovered he had tuberculosis. Sadly, due to the stigma and discrimination surrounding the disease, he would not speak up or seek for help. His death was a painful reminder that we could have intervened and saved a life if only we had known earlier. Tuberculosis is an airborne disease that primarily affects the lungs, but can also impact other parts of the body. Being airborne means anyone, regardless of their social economic status, can contract it. In Nigeria, 1 person dies of TB-related illness every 7 minutes, amounting to 206 deaths every day. Globally, 1 person succumbs to TB every 25 seconds, which is a staggering 3,456 lives lost daily. These deaths are entirely preventable because TB is curable if detected and treated early. If you or someone you know has been coughing for 2 weeks or more, coughing up blood, experiencing night sweats, or losing weight drastically, it might be TB. Please visit the nearest government hospital or primary healthcare center for proper diagnosis and treatment. TB treatment is free in all government and some private health facilities. Let us also remember not to stigmatize or discriminate against TB patients or those who have been treated for TB. Individuals who have been cured of TB cannot infect others. I call on all stakeholders, especially the private sector, to join us in the fight to end TB in Nigeria. Together, we can make a difference. Remember, TB anywhere is TB everywhere. End TB by 2030. Yes, we can.
The new Happic sachets. It has a thick formula, so all you need is just 1 sachet for your toilet bowl. It gives 10 times better cleaning and big savings too.
Wow, Helen!
Sparkling clean toilet with Happic sachet.
Hi.
You don't know when you have bacteria breath, and bacteria may be the cause of it. Don't let bacteria breath get all the attention. Use Close-Up with antibacterial zinc. Close-Up helps get rid of bacteria breath.
The counsel of our fathers.
I will urge and advise our younger generation to use talent and brain to sort out problems, not arms.
Nigerian youths, let's build our nation together.
The Nigerian national flag represents our country's history, culture, and identity. It was designed in 1959. The colors are Emerald Green 2.0, which represents agriculture, and Immaculate White represents unity and peace. Know how to handle our flag. Illuminate the environment or don't fly the flag overnight. Do not fly a dirty or tattered flag. Take such flag to the nearest National Orientation Agency office for proper disposal and replacement. The national flag can only be flown at half-mast on the directive of the federal government. The national flag must be flown at the same or higher height when displayed alongside other flags. Don't burn or allow the national flag to fall on the ground. Do not print, decorate, modify, or insert the coat of arms on the flag. Our national heroes are not buried with the flag. They are honored by presenting it to their next of kin during interment. Respect our national flag. Be a real Nigerian.
This message was brought to you by the National Orientation Agency, NOA.
Nigeria is perched on the treasure trove of solid minerals. Gold, coal, tantalum, tin, but none is more critical to our future or the world's future like lithium.
Let's talk about illegal mining operations. What is our strategy?
This Saturday, Leganés
Barcelona. Leganes versus Barcelona. Live on Sporty TV.
Brought to you by SportyBet. Play with champions.
All right, thank you for staying with us, and time for us to get into the papers in a moment.
All right, it's a pleasure as always to introduce Chukwudi Okoli Obaja this morning. Many thanks for joining us, sir. Good morning to you.
My dear Nyere, what are we if we are not found at our duty post all the time? Kudos to journalists. How are you, Victor?
I'm fine, as fine as you are.
You always look fine.
Are you sure you're as fine as he is? Today is Friday. He creaks on Friday.
No. There you go. Don't join him. You'll break my heart if you join him.
No, I'm just...
Lead us into the papers.
All right, so let's see what the papers have. We'll begin with the Daily Times this morning, and the lead story here is young people don't need freebies, they need capital. And that's according to Additional. Away from that, we have APC Mons Principal Officer shut down office. That's on page 9. Hold public hearing on FCT fund land allocation. CP PDP challenges Wiki. All right, you want to find out what that's about. Page 7 will guide you. NAPTIP BDM partner to rescue trafficked Nigerian girls in Ivory Coast. VDM, would that be Very Dark Man? That's on page 10. You want to find out what VDM stands for, of course. And away from all of that, above the masthead, we have court strikes out Nnamdi Kanu's 50 billion naira suit against the federal government. Details on page 5 of the Daily Times. And finally, in the red strip, we have Public Affairs Minister cancels security agencies on approach to end terrorism. All right, so that's the much you can take from the Daily Times this morning. Let's see what the People's Daily has. The People's Daily leads to something completely different. It says National Assembly North East legislators protest exclusion from federal government programs. All right, so that's on page 15 of the People's Daily. Above that story, federal government orders tertiary institutions to advertise job vacancies. That's on page 6. Yobe government to reintegrate repented Boko Haram members as bandits again kill 3 in Benue community. Very sad. On page 5 has all of that. Below the picture story, we have Nigeria to launch e-visa digital cards. Some other headlines on the front page here. We have federal government Edo State set up fact-finding committee over Oromi killings. That's still in the news. And of course, 80% of Renewed Hope social housing program to be sold to Nigerians living in local government areas. Finally, from the People's Daily this morning, we have no decision yet on Supreme Court ordered ward delineation in Warri, says INEC, and that's on page 3. All right, so Victor.
All right, thank you, Yenre. And I have the blueprint, a fully loaded blueprint. Let me begin with the lead story, which reads 2025 flood forecast. Benue, Lagos, Rivers, Jigawa, FCT, 26 other states at high risk. And it has 3 riders. Coastal states may experience rising sea level. FG to commence pilot insurance scheme for Kogi, Jigawa, and N Hyperdeck awards 600 million naira contract to Muye flood contract project. That story continues on page 8. And just beside it, Dangote refinery slashes petrol price to 865 naira per litre. For details, you find it on page 8. At the bottom of the front page of the blueprint, alleged assassination plot. Akpabio petitions IG, demands Natasha's prosecution. All right, never ends. Just above the nameplate, Idris markets Tinubu's reforms in France, woos investors. That story is on page 10. And a quick 3 just beneath under the nameplate. JAMB vows to punish 180 candidates who paid 30,000 naira each to cheat. That's on page 14. Interesting. In business, CBN's PMI rises to 51.4% in March 2025. It's on page 19. And in sports, Unity Cup 2025, Brentford's G-Tech Community Stadium to host Nigeria, Jamaica, Ghana, and Trinidad battles. That's on page 32. And there are other stories, but just before we go, Northeast NAS Caucus rejects exclusion from $530 million SAPZ project. Is on page 6. And the AKU, which Yere isn't a fan of, Nigerian nurse abandons US to pursue simpler life back home. And the other parrot says, in the spirit of Jakpada. Okay, Chukwudi.
The spirit of what?
Jakpada.
Jakpada.
Jakpa is to go away and Jakpada is to return.
Ooh, what part of the lexicon is that?
That's Yoruba.
Anyway, the truth is that some Nigerian words are finding their way into the lexicon of the British people. That's English. It helps you. What they are doing actually is to help you understand when, if you come to Nigeria, you hear such words. Not that in Britain you say, I'm Jakpaing tomorrow and people will understand you. Anyway, you see, if I were to run into him on the street there, I'll just call him Dangi Baba. That's talking about Dangote. Oh, yes, please. You know, when you see the humility on that man's face, I've always talked about it, you actually get the impression of a good heart. But we're talking business. Getting returns on investment for a $20 billion refinery is not about sentiment. So business has to be thought about. But we like the fact that he's saying petrol goes down to 865 and not 880.
Good news.
You know, there was this rumor that government was no longer interested in their renegotiating the Naira for crude thing because government is losing revenue, NNPCL, petrol is no longer high enough, it's not giving, and the government allayed the fears of people by saying, come on, energy security is at the heart of everything, and we're not going to compromise it. Let us all make it work. It's very good news. I'll keep on praying for Dangote. Yes.
But if you're looking for a nickname, for him, his friend Tony Elumelu calls him Ali Cash.
Oh, really? Tell Elumelu that they should add Dangi Baba to it.
And JAM vows to punish 180 candidates who paid 30,000 naira each to cheat.
What are they going to do to those who encouraged it? It takes two to tango.
Those who paid and those who received.
Somebody looked the other way. Somebody, well, maybe that's not the case because somebody caught them. The other side definitely was vigilant enough to notice that these people were cheating. So let's be careful what we drop from our lips. It's good news. I've never, for those of us who wrote mathematics 3 times and failed it 4 times, I never wasted my time in the hall for more than 15 minutes. Take the pay.
You just drop your pen and go away.
No, I'm not joking. Well, I don't deceive myself in life. X and Y ruined my life when it came to mathematics. I was doing well with, if a train carries 20 tons of coal with 3 gallons of petrol, how many? I was doing well. I was winning the pencils and the erasers till X and Y got into the fray. It's unfortunate, really.
We can still remedy the situation, by the way.
I am going to pass maths. But please, let's go to more important things. Young people don't need freebies, they need capital. That's coming from Africa Development Bank, President, our own dot tie man, additional. I like that man a lot. I hope he comes into politics in this country. He's not renewing his tenure. He's not going to go beyond. Some people are already angling to take his place. When he finishes, let him come here. I'm going to be one of the people. Sure? I might join politics if he decides to opt in.
I'll pretend I didn't hear that.
You didn't hear it.
And the 2025 flood forecast?
Not a good one at all.
It's never a good one because the real thing is ice is melting. When they tell you about rising sea level, it's not that the rains are coming more from the heavens than they ever did. Ice is melting. The polar regions are cracking up and the waters are being poured onto land. And remember, the land compared to sea, the percentage is a lot lower. You have more water on the surface of the earth than land. So we really are being hemmed in, so to speak, by flooding.
So what do we do
But the
about
Nigerian
it?
case, we have always said, how much can we try to be proactive rather than reactive? But we must accept that fighting the floods of Nigeria is not going to be something that only the federal government, the states, or the local governments can handle. It needs global assistance at the UN level. I think they've been doing that through some of their agencies and all that. But it's not a laughing matter. Farmlands will be washed away again, and that is loss of revenue to farmers who are even troubled by subsistence farming. We have to really do all we can to become more proactive. Stop building houses to block drainages. That's why I applaud those, starting from El Rufai, who said that house cannot stand. We don't care who owns it in Abuja, because it was one way to fight flood. Once you block nature, nature claims its path. So these are some of the things we need to do. And those who live in the riverine areas, let us teach them security. Oh, we've been here for a long time. Our forefathers have been here. Flood does not hear that. The rage of nature is really a rage. So some awareness needs to go out to people who are in these flood-prone areas.
My worry, Chugode, is that
Yes.
I can play back in my head all you've just said and imagine you saying same next year. The question
It's become
is,
a ritual.
what have we done through the years?
It's become a ritual,
This
really.
is annual. It happens all the time.
Yes.
So what have we done? What are we doing?
It's become a ritual. We need to be more proactive. We need to really mean it. We don't have to wait for this cyclical. We don't need to wait for these annual repetitions. As you said, we're not being pessimistic. We're not being caustic. The truth is that next year, we're likely to say exactly what we're saying now. And then somebody's going to write alarming headlines about crocodiles swimming the streets of Lokoja maybe sometime in August. We hear fairy tale. We have to work to make sure that these waters do not bring their anger onto places where we do not want them.
And maybe we need to call, the fact that, or rather just pray that those who benefit from all of this, when there's flooding and then they benefit somehow, in a bid to, if you like, provide some form of relief for those who are, suffering from the flooding. I mean, can just think about humanity, think about the safety of Nigerians first, and let's the energy that we're channeling into providing relief after the flooding has taken place, into making sure that it doesn't happen in the first place, or the disaster that occurs as a result of it, is not as huge as it usually is. I think if we channel our energy that way, if those
exactly
who should do the needful
the stories we hear about funds even being diverted, you ask yourself, how could somebody who is in charge of pensions hold back the pensions of people? But that happens. There was a man I rescued in Benin City in those days. After 2 years, I found out a DG was holding his file. I told him, sir, look, they said you signed for this in one western state where he went to. Since 2 years, he kept it. What was he keeping it for? The man started getting his pension after 1 month.
Well, I just hope we
so you're asking us to have a heart.
Exactly.
Let us be humane. Let us care for, reach out for the other person.
Well, thank you, Chukudi Kulubaja. We'll have to let you go. And because you've been in high spirits today, as Yen Ray found out, go get yourself a cup of coffee.
I'm always in high spirits.
Good Morning Nigeria continues after this break. Please don't go away.
The Nigerian national flag represents our country's history, culture, and identity. It was designed in 1959. The colors are Emerald Green 2.0, which represents agriculture, and Immaculate White represents unity and peace. Know how to handle our flag. Illuminate the environment or don't fly the flag overnight. Do not fly a dirty or tattered flag. Take such flag to the nearest National Orientation Agency office for proper disposal and replacement. The national flag can only be flown at half-mast on the directive of the federal government. The national flag must be flown at the same or higher height when displayed alongside other flags. Don't burn or allow the national flag to fall on the ground. Do not print, decorate, modify, or insert the coat of arms on the flag. Our national heroes are not buried with the flag. They are honored by presenting it to their next of kin during interment. Respect our national flag. Be a real Nigerian.
This message was brought to you by the National Orientation Agency, NOA.
Hi.
You don't know when you have bacteria breath, and bacteria may be the cause of it. Don't let bacteria breath get all the attention. Use Close-Up with antibacterial zinc. Close-Up helps get rid of bacteria breath.
Hey Nigeria, ready to breathe cleaner air and save money? Let's talk about gas. Drive with CNG, the smart, cost-effective choice. Fill up for less and travel further. Save money, save the planet. Switch to LPG for cooking. It's cleaner, healthier, and better for environment. Say goodbye to smoke and eye problems. Do you know Nigeria is a gas nation ranked 9th globally with over 209 trillion cubic feet of gas reserve? Gas isn't just for cooking and driving. It powers industries too. Cleaner, cheaper, and more efficient. And the best part, conversion centers are popping up everywhere. It's never been easier to switch to gas. Join the cleaner energy revolution. Choose LPG for cooking and CNG for your vehicles. Clean energy for brighter future. This message is brought to you by the Office of the Honorable Minister of State for Petroleum Resources, Gas, supported by the Nigeria Midstream and Downstream Petroleum Regulatory Authority, NMDPRA.
The Nigeria Coat of Arms is the official seal that represents the authority of the Federal Republic of Nigeria, hung on the wall behind the seat of the principal officer of the government, supported by the portrait of the serving President of the Federal Republic of Nigeria. It has 7 features. The black shield stands for Good Earth of Nigeria. The silver wavy band stands for the confluence of rivers Niger and Benue. The 2 white horses stands for dignity. The yellow flora is a common wildflower throughout Nigeria. The red eagle stands for strength. The wreath is in our national colors of green, white, green. The motto, unity and faith, peace and progress, is written on a beautiful yellow ribbon, and it's a maxim for all Nigerians. Be a real Nigerian.
This Saturday, FC Bayern München, Borussia Dortmund, watch live FC Bayern München versus Dortmund on Sporty TV.
SportyBet sponsors coverage of the German Bundesliga.
Welcome to Silver Oasis.
Silver Oasis, a TV series dedicated to aging and older persons in Nigeria. Be part of this series and discover the transformative programs crafted to give a new lease of life to our senior citizens, courtesy of the National Senior Citizen Center.
The National Senior Citizen Center is the oasis for the senior citizens.
For thought-provoking discussions on aging, geriatric social care, and issues that matter most to our senior citizens.
Silver Oasis.
Silver Oasis.
Silver Oasis.
Tune in to Silver Oasis on the network service of the NGA every Saturday at 10:05 p.m. Silver Oasis, improving the quality of lives of senior citizens.
This Saturday, Southampton.
Good run off the post and in this time. Two-touch football from Saints. Fernandez for Onuachu. Oh, there's the opening goal.
Aston Villa.
So involvement by Asensio. Villa have their winner.
Now, Morgan Rogers with decision to make. He's cutting back. Nailed it into the corner.
Southampton versus Aston Villa. Live on Sporty TV.
SportyBet sponsors coverage of the English Premier League.
All right, welcome back. It's still Good Morning Nigeria, live on the network service of the NTA. And just to begin our conversation this morning, which is on maternal health and well-being, let's take a look at this background report put together by our correspondent, Ibrahim Ben Hamidou.
Maternal mortality remains a significant concern in Nigeria, where access to quality healthcare plays a critical role in preventing these tragic outcomes. According to the World Health Organization, most maternal deaths are preventable with timely access to quality healthcare. However, inadequate healthcare infrastructure, lack of skilled birth attendants, and socio-economic factors continue to hinder progress. In response to these challenges, the federal government has implemented initiatives to improve maternal health, such as the Midwife Service Scheme and the Saving 1 Million Lives program. These programs aim to increase access to quality maternal care and reduce maternal mortality, addressing some of the systemic issues that contribute to poor health outcomes. Building on these efforts, community-based interventions have shown promise in improving maternal health outcomes. The African Population and Health Research Center, APHRC, highlights the importance of engaging local communities in promoting maternal health. Traditional birth attendants, community health workers, and peer support groups can play a vital role in providing care and support to pregnant women, bridging gaps in healthcare access and delivery. Experts in the field of maternal health and motherhood well-being will discuss the challenges, opportunities, and solutions to improving maternal health outcomes in Nigeria, including policy interventions, community-based initiatives, and innovative healthcare solutions. This discussion will shed light on the complexities of maternal health in Nigeria and potential pathways to progress. It's about saving lives on Good Morning Nigeria, as the guests are seated already.
All right, many thanks, Ibrahim Hamidou, for that background report. And now joining us to begin our conversation on maternal health and well-being, let me first introduce Dr. Mahmoud Rabia Ahmed, consultant obstetrician and gynecologist. It's a pleasure to welcome you to Good Morning Nigeria.
Good morning, Nigeria. Thank you very much.
Henry.
Yeah, and also with us here in the studio for this conversation is also from the National Hospital and a senior consultant obstetrician and gynecologist, the president-elect Medical Women Association of Nigeria. It's a pleasure to have with us Dr. Maureen Umemwo.
Good morning, Nigerians.
I hope I got that right.
Yes, Dr. Maureen Umemwo Umakewolo.
Oh, wow.
Maybe you just keep to the last one, Umakewolo.
All right, we'll find a way out of it.
Well, let's begin the conversation. Now, when we say maternal health, if we talk maternal health and well-being, in addition to it, what precisely do we mean?
Good. Thanks for just a wonderful question. When we talk of maternal health, before we move to other parts of maternal well-being, we are talking of maternal health in a holistic pattern. And if you want to talk of maternal health, you talk from birth. From the time you are bringing a woman to the world, you start talking of maternal health. Because it's all the summation of her growth, her educational achievements, her well-being. All of them will culminate to what we call maternal health. Why am I saying that? If you give birth to a baby girl and she's not well, nutritionally, she's not well taken care of, it's already affecting her obstetric fissure. the development of her pelvis, the things that will lead to complicated childbirth is already there. So from the time of birth of a baby girl, the growth, the nutritional aspect, and most importantly, her educational achievement, her level of education. If you power a girl, you've empowered the whole nation. And if you move from her educational achievement, you move to her marriage, pregnancy, all is about maternal health. And also social and societal factors affecting that woman. All of them are factors, important targets we have to consider for us to achieve a good maternal health. Yeah.
That's very deep, Dr. Umekwa Ulu. Thank you so much. Anyways, very deep. From birth of a girl child, you must begin to think about the maternal, health of that child. And I'm just thinking, are we anywhere to getting it right in Nigeria? Because the statistics are alarming when it comes to maternal death in the country. Yes, so many governments have come and gone, and effort has been made, but not much progress has been made in that regard. But I would like to hear from you, Dr. Ahmad. What really the challenges? She's talked about, starting from birth. Where is there a major problem? Is it really from birth of a girl child, or is it at the point where she gets pregnant?
Okay. All right. Thank you very much. So the problem, as we've mentioned earlier, starts right from birth, and then afterwards it's cut across a lot of areas. First of all, girl-child education. You need to educate the girl child. You need to empower the girl child to know what it means to take care of yourself, to know what it is to be healthy. That is very important, because when you educate a girl child, she can be able to access healthcare as a priority, and that would take care of the problem. That's the first one. The second thing is women empowerment. You need to empower the women to know that I am in charge. So when you're in charge, poverty is out of the question, and that would take care of it. Another thing that can take care of all these maternal health issues is access to healthcare, safe healthcare programs. So number one is having skilled birth attendants. Having skilled birth attendants in facilities that are well equipped is also a very, very important way forward, and this would curb the menace of maternal mortality that's affecting us. Another issue is also having access to family planning. Modern contraceptive options are ways of helping women to prevent high-risk pregnancies, high-risk childbirth, all the childbirth issues, and this would also help in preventing this problem. And then another thing that could also be is access to antenatal care services. And lastly, respective maternity care. Having women going to the hospital, and then they're being attended to respectfully, they're not being abused. This would encourage them to come back, and this would also encourage them to send other people to come to the healthcare facility to seek for care.
All right, thank you very much, Dr. Mahmood. Let's now introduce our guest from Port Harcourt. I'm told she's ready now. Onyedikachi Ewe is a senior program lead at the Nigeria Health Watch. Thank you very much for joining us.
Good morning, and thank you, Nigeria, for having me on the studio this morning. Thank you.
Now, let me stay with you at the moment. What's your assessment of maternal health in Nigeria? Would you say we are making real progress or stagnating?
Okay, I missed that question. Please, can you come again?
What is your assessment of maternal health in Nigeria? Are we making progress or we are stagnating?
Okay, regarding progress, yes, we are making progress. However, how quick is that progress? So that's where the discussion lies. The Sustainable Development Goals 3.1 target stipulates that maternal mortality should be less than 70 deaths per 100,000 live births by year 2030. But where are we in Nigeria? The 2022 World Health Organization report recorded that over 1,000 women, 1,047 women lost their lives as a result of pregnancy, childbirth, and postpartum related issues. However, the 2023 reports have just been published, and there's a slight decline at 993. So you see that somehow there's progress. However, when you compare 993 to 70, which is the global goal, you would see that we are far apart. And if you say 2030 is the target, this is 2025, we're midway towards the Sustainable Development Goal achievement in 2030. And we are still way behind. Women are still dying. Let's put it in context. In every 200 women who give birth in Nigeria, one woman dies. So that's a very tragic figure, if I may put it that way, and it is huge that women have to die giving birth in Nigeria. So there is need, and there's an urgent need to accelerate action so that women can have safer births, women can have safer pregnancies, and childbirth will not be a reason for loss of life.
So, Yedikachi, we'll get back to you shortly. Let's return to the studio now, and I'd like to get to Dr. Ahmed, and it's for a reason. All of the reasons mentioned so far, there could be factors responsible for poor maternal health, if you like, a good one. We talked about education, you talked about access to healthcare, but we didn't talk about culture. And I'm thinking that cultural practices, is playing a critical role in maternal health, or if you like, maternal mortality in the country. But speak to us specifically about that. How is it affecting, women generally?
Okay, thank you very much for that. Cultural practices, especially the harmful cultural practices, play a vital role in accelerated maternal mortality and morbidity in Nigeria. So we have what is known as the 3 delays of maternal mortality. The first delay is the delay in making decision. So before they even make decision to go into the health facility is a big problem. What am I talking about? Making a decision. If now a woman is pregnant and she has an emergency and needs to go to the hospital, before that decision is made, there will be a lot of obstacles. First of all, the male partner, maybe the husband is not around, or maybe the husband is around and he would have to get a permission from maybe the community leader or an elder in the community, and maybe that elder is not around. So it takes a long time before the decision is made to decide on taking the patient to the healthcare facility. And then also, male involvement is another cultural taboo that happens. A lot of times now there is no male involvement, community involvement, it's not there. And this woman needs a lot of support from the male partner, and then generally the families, and then the communities at large. So these are part of some of the cultural problems that happen. And then we know in some cultures, when a woman is pregnant, there's something that's known as they're not being exposed to that particular environment. So with that, they're not able to express their problem, and then it is kept in the environment. And then some people think going to the hospital is a problem, so they'd rather stay in the community where they're not skilled birth attendants to take care of the pregnant patient, and they will end up with quacks, and then this would aggravate the problem and cause more harm than good.
But what do you think about the practice of girls getting married early and venturing into childbearing at I mean, you're the health professional. You
Yes.
tell us when a woman is actually ready to go through that journey of pregnancy and bringing life into this world.
Okay, yes. So that is another problem. We talk about teenage pregnancy, and just as my senior colleague mentioned, we know nutrition is very important, because if the woman is not fed well, the pelvis is not well developed, and if the pelvis is not well developed and then she gets married early, there's problem of what is known, she can have what is known as an obstructed labor, because the pelvis is not well developed, maybe from a nutritional problem, and then she might end up laboring at home, where still, as I've mentioned, there's problem with having skilled birth attendants. So the problem might not be identified early until when it is absolutely late. So before she gets to the health facility, it's actually a very late presentation whereby already complications have set in. So yes, teenage problem can be a big problem as a cultural reason to having maternal morbidity and mortality, because one of the commonest cause of maternal mortality in Nigeria is obstructed labor and its complications. But then if we're able to go to antenatal care, and it is identified early, then we can take care of it to prevent complications like vesicovaginal fistula, having problems with the legs from happening.
All right, Dr. Mahmoud, thank you very much. You've talked about the cultural inhibitions to getting quality maternal health care. But let's talk about access, Dr. Maureen. Let's talk about access. How accessible are quality maternal health care services to women, particularly in rural communities?
This is a very important area, because that's anytime we want to talk of maternal mortality, we have to talk about our state, the state of our primary health care centers. Because the recent studies show that most of the maternal deaths are usually recorded, in fact above 80%, precisely a study brought out 80.8%, that most of them, we tend to record them while in the community, not within the hospital. So if we can prevent death happening in the communities, we can prevent more than 80% of maternal death we are talking about. Using Nigeria, for example, what are we going to do to comb the high rate of maternal death in terms of access? Because we're talking of accessibility of treatment. And I have to remind you that Nigeria is still leading among the whole country. We're still leading in maternal mortality. In fact, globally, it has been shown that 28.5% of maternal death recorded within Nigeria.
Mm.
So we are dealing with a catastrophic state. We are dealing with a situation we all need to rise up and act. And it starts from the community, as you two asked me. What's the state of our primary healthcare centers? What's the coverage? How many of our doctors are working in our primary healthcare centers? How many of our certified midwives are in primary healthcare center? What of that poor woman that will start laboring at night? How can she come out? How can she move to that primary healthcare center? Do we have emergency ambulances? Some people, we cannot even boast of good road network. But there are things we can do to circumvent it. We can turn our neighborhood KK, this normal KK, to an interim ambulances, that a poor young woman laboring by 2 a.m. We have a village person in charge of that community that can help her at that moment. If we want to talk of maternal mortality, we have to go back to our communities. Now, that primary health care, are you aware that some primary health care centers, they don't run at night? So as we are closing as civil servants, they are also closing. And by nature, labor tend to start at night. Who takes care of those emergencies at night? Now, what of availability of equipment and drugs? Nigeria, if we want to fight maternal death, we have to make antenatal care free. At this juncture, I would like to thank our president also for the recent approval he gave, making cesarean section free. It's a wonderful one at that.
Is it for every Nigerian woman or for those who cannot afford it?
No, for every Nigerian woman, I think so. The recent approval last year by President Tinubu, because our minister told us that cesarean section is supposed to be free in Nigeria. That's what I heard. But I don't know the category, but I know it has been signed.
I think the cesarean section is just, for those who need it and maybe cannot afford it. Okay. They're supposed to be, taken care of to ensure that the mother and child.
But how do you determine that, and at what pace do you determine that?
There are so many issues. Listening to you, Doctor, I'm thinking that yes, in rural areas we do not have adequate facility. Health professionals are scarce, but even in urban areas, we still get to hear about maternal mortality, maybe as a result of negligence on the part of the professionals who should attend to women. There's this trending story at the moment about a man who lost his wife. He had rushed her to a hospital and he was asked to pay to deposit about 500,000, and he couldn't, get around it, and somehow the woman died. I want to ask Onyedikachi Ewe, because you're a senior program lead at Nigeria Health Watch. In your watch, and of course looking at maternal mortality, I want you to speak about negligence. Speak about the fact, she just talked about cesarean section. There's this report I read somewhere that in many hospitals in urban centers, doctors would prefer to go the way of cesarean instead of having a woman have normal delivery, even when it is possible, in a bid to, so many reasons. Maybe you can tell us, doctors, but speak to us about this really. How is this impacting, on maternal health and mortality in Nigeria?
Dr. Maureen has mentioned the fact that there is high rate of she was speaking to access. Now, when we talk about access, we can look at it from both the geographical and also the financial aspect. I'm glad you just made reference to the tragic incident that occurred in Lagos, where a woman could not reach the facility, which is one of the delays in the well-documented 3-delay model that leads to maternal death in Nigeria and even globally. One key to addressing maternal mortality, amongst a whole lot of efforts and interventions, is early antenatal. Early antenatal. So the course and the history of the pregnancy needs to be monitored and studied, so that if there are any danger signs, warning signs, there can be prompt and appropriate referrals. So the woman does not have to experience the delay in seeking or accessing quality maternal health care, which usually leads to these maternal deaths. So for these incidents of negligence, maybe the woman has had the first, the second, and feels more experienced to handle some other conditions, women should be reminded and continuously reminded, which is one importance of the Safe Motherhood Day, that the high rate of maternal mortality in Nigeria even makes the country one of the risky places in the world to have a baby. Pregnancy is, but we do not want this narrative to continue, which is why we are having these conversations, leading these conversations, so that the issues can be addressed. Women should register early and have their pregnancies monitored, so that any danger signs, warning signs can be quickly identified and also rectified. I was also going to talk about financial access. Now we have the NHIA Act that was signed into an act in 2022, and there are provisions for Nigerians to register, get a health insurance policy, and access medical health as a part of government efforts to improve or achieve universal health coverage. Because in a country where we have 40% living below poverty line, you would see that people are scared to go to the hospital because of the financial implications. They do not have the funds to access care. But with the NHIA Act, we see that there are provisions made, but how many people are aware of these provisions? How many people are accessing it? How many people are covered under the NHIA? And according to the NHIA strategic plan, the target by 2030 should be 90% coverage for Nigerians. However, we are still at 5%. So that's a huge gap, and that's a huge lag. And this financial access to healthcare is one of the great challenges that would make it look like an individual or a couple are being negligent about their health. So women should be informed and continuously, enlightened and educated on the need for focused antenatal visits to be able to identify warning signs, danger signs, and have it promptly addressed.
You're talking about negligence on the part of, mothers and, maybe their spouses. But let's also talk about negligence on the part of medical professionals. I think that's where I was trying to go to. And Dr. Ahmed, I'm sure you can speak to us about that. Because, when we talk about the rural areas, yes, no access in terms of, but even in the urban areas where there's access, you go to all these hospitals, you get there, nurses are busy. They tell you, can't you see your mates? You're screaming and you're asking for a certain kind of attention. They tell you, oh, you just came, you have to stay on the queue. Nobody's really paying attention. And then, oh, you've been there 4 hours, and there's no patience, there's no time. They're like, oh, get the money ready, let's have a cesarean. We don't have that time. Or all of that. No proper monitoring of mothers, maybe because some will say, well, they are overburdened. The Jackpot syndrome, of course, a lot of doctors are leaving, and the few available don't have the you are in the health sector, so you know what I'm talking about, and all the stories that emanate from all of this, and how it results in maternal mortalities and sometimes in child death.
Okay, thank you very much for that. As I've mentioned earlier, the 3 delays, the 3D models, the first one, as I've mentioned, is the one in accessing care and getting to the healthcare, making decision. That's the first one, which we talk about the cultural problems. Then the second one is delay in getting to the healthcare facility. That has to do with our roads and problem of transportation to get to the hospital. And the last one is accessing care when the patients get to the healthcare facility. So what happens when the patient gets to the healthcare facility? Sometimes, as you've mentioned, these patients are coming from remote areas. They're not well educated. They're not empowered. They don't even know their left from their right. So when they get to the healthcare facility, to even navigate and get to the right place where they can have access to care is a problem. That's one of it. Number 2, when you get there, of course, you've mentioned the Jackpot syndrome. The healthcare providers maybe are overwhelmed. They have a number of patients with them before they attend to one patient and then the other. But the good part of it is, for places where we have skilled healthcare providers, there's what is known as triaging. Once you have a patient coming into you and you triage the cold cases and those that are emergency. You start with the emergency cases so that you prevent any untoward effect from happening. And another thing that happened again is access to equipments, facilities. Sometimes the patients will come and they might need some investigations which might not be readily available in that particular healthcare facility that they are. So they need to get access to all those things. So sometimes there's a problem with access in the healthcare facility, and it ranges from the services, the provider, you understand, and then also the attitude of the patient. And that's why I mentioned earlier that we need girl-child education. Once we educate them, we empower them, all these things can be taken care of.
All right, Dr. Ahmed, thank you very much. Let's also talk about skilled birth attendants. We often hear about that, right? Dr. Umakwe. We hear about skilled birth attendants. How well are we training the personnel and deploying them? And what does it even mean in real practice?
Thanks so much for the question. And it's a very important area. Remember earlier I mentioned it about skilled birth attendants. And it's good to also understand the full meaning of being a skilled birth. Because in Nigeria, we have so many people that claim to be skilled birth attendants. Starting from our pastors, our imams, traditional birth attendants, and let me tell you the truth, most of the maternal mortality we are talking about now, those places are the originators of maternal mortality we are having. So in Nigeria, we have to have an organized, certified, because anybody can say, I'm a skilled birth attendant. The person must be certified. And unfortunately, we have weak regulatory system in Nigeria. We need to have system that will regulate people that are taking care of our pregnant women. And we have to follow up those places, what is going on. Our primary health care centers, I kept on mentioning it. If we get it right there, other things will follow. Admittedly, as you asked, some deaths are actually happening within the tertiary institution, even at that, among trained professionals. We will also not exonerate ourselves completely for negligence. Attitude is there. We can't exonerate ourselves. But we're talking of preventable ones. So why training? We need to train our skilled birth attendants. We have to have dedicated midwives that we know that can man our primary health care centers. And Nigeria is a big country. I don't think it can take anything from Nigeria for making sure that at least we have a doctor or two doctors overseeing our primary health care centers. Last 2 weeks, I managed a woman. She actually booked in a primary health care center. Unfortunately, I don't know who managed her. She was referred to us when she started convulsing. And when we delivered her at term, we were getting out a baby weighing 800 grams at term. So that woman has been having IUGR, intrauterine growth retardation, without diagnosis for a long time. And she told us that she has been coming for antenatal as when due in primary health care center. So it means there is failure with the person managing her. And she lost her baby and almost turned a near mix for us. We thank God we were able to, to bring her back. But she booked for antenatal. So having a skilled birth attendant is very important. Regular training of skilled birth attendant is also very important. And most importantly, where our mothers are supposed to go. And people claiming to be certified birth attendants, the government needs to look into that. And also, as we say, so we won't be talking of only primary health care centers. Our secondary centers and tertiary centers also, we need to look into them. The attitude, as you mentioned, the aspect of negligence, and let me tell you the truth. The more important is how many doctors are available to take care of these women. Doctors are human. They can be tired. When you are tired, you will be a bit irritable. You will be weak. We need more skilled birth attendants. We need more doctors. We need more training and also the infrastructure. So we're not talking about having trained, certified, skilled birth attendants. We are also talking about the infrastructure. We are also talking about availability of not only nurses, but medical professionals. because not only doctors, sorry, but medical professionals, because only doctors cannot do it alone. We need a holistic approach.
So how much of this is a policy issue? Let me take this question to Onyedikachi in Port Harcourt. How much of policy intervention can we apply to solving all of these issues?
Okay, there are a lot of policy interventions that are currently going on. The Coordinating Minister of Health and Social Welfare has graced the screen of various media houses talking about the maternal and neonatal mortality, Maternal and Neonatal Mortality Innovation Initiative. That's MAMI. It was launched at the Joint Annual Review, November 2024, and implementation kicked off January this year. And it's under that initiative that there is provisions for free cesarean sessions for women, depending on the cause and the history of their pregnancy. And the initiative is also trying to strengthen referrals between the basic facilities where the BMONC, where women in the rural and underserved regions access care, the referral from those facilities to secondary facilities, or the ones that are called the CMONC facilities. So efforts exist in all ramifications. Efforts exist, but is it enough? The health system is still largely underfunded. The referral system is still weak. There are provisions to make emergency transport system available and more accessible, but how effective in terms of implementation is this taking place at these rural settings? And there's still a wide gap between policy and implementation. So it's a complex web of challenges, and it requires concerted efforts from, government, healthcare providers, communities, and even individuals. We cannot also talk about maternal health without talking about addressing the social determinants of health, poverty, and education. An educated woman, in fact, if you look at the indices on the Nigeria Demographic Health Survey, you would see that women, or in regions where women are having up to secondary education upwards, the maternal mortality rate is lower than in regions where women do not have any form of education. So education is already a very critical empowerment for a woman to seek information and know when to access care, where to access care, and also to make informed reproductive health decisions regarding family planning, regarding other reproductive health choices. So when we talk about policy implementations, policy interventions, yes, there are policy interventions. But is it enough? We need to talk about scale. We need to talk about coordination of these policies to achieve maternal health improvements in Nigeria.
Thanks, Onyedikachi. At this point, maybe we should, celebrate and appreciate the First Lady of Nigeria. At the moment, she's moving to different zones in the country, trying to equip midwives, with the right equipment, just so that they can do their jobs properly. I mean, she's been to like 2-3 regions already, and of course that should be commended. I mean, that will go a long way in assisting the midwives to do their jobs. Yeah. But while we speak around all these issues, let's talk about some of the myths that is also affecting maternal health and resulting to mortality. We talked about educated people, yes, but there are some educated people who will never have a cesarean section. They'll tell you that maybe by virtue of religion, you want to be like a Hebrew woman. That's what they call it, something like that. They tell you women who have cesarean sections are not real women or something. So I mean, they would do everything, no matter how risky it is for them, to have a normal delivery. She talked about family planning, for example. There are women who will never go for family planning. They'll tell you, well, if you have family planning, you will never conceive, or you know. I mean, all these issues are affecting at the end of the day. How do we change all of this? Because I mean, for some, it's been passed from generation to generation. Oh, my mother has 7 children. She had them naturally. Why would I have cesarean? I'm not. I mean, your mother comes into the labor room and tells you, I had 12 children. So you too, you must go through this. It's normal. Speak to us really. How can we begin to change all of this, just so that some of these myths, some of these beliefs, we change them and save ourselves and our babies?
Okay. Thank you very much for that. That's really very insightful. So one of the ways to take care of these myths and misconception, it's right from the beginning. Girl-child education. Education, education, education cannot be overemphasized. Once you educate the girl child, once you educate a woman, you're educating the whole community. Because once you educate the girl child, she will take charge of her health. She will know that this is her right. It's not a luxury. So knowing that I am sick, I need to listen to, go to the hospital, listen to my doctors, do what is that's asked by the doctors to be done is something that is very important. So education is very important. Second thing, it still goes to empowerment. Empowering the women, it's also very important, because sometimes they would have agreed to go for the cesarean section, but because of abject poverty, you understand, they might not be able to have access to those services. So once you empower them and they take their health as their own and they take charge of it and they take it as their own right, they would go to have access to all these services. And another thing that we can do to prevent this myths and misconception is involving the families, the communities, very important, and then male involvement. Because as I've mentioned earlier, sometimes they think if you are sick, you don't go to the hospital. Maybe some of them will say, okay, you're a female, you cannot go and be seen by somebody else. You understand all those cultural problems that maybe a female has to see a female, gender dynamics and all that kind of thing. So that is, once you educate that, because health is wealth. You need to be healthy to be alive, to know that someone takes care of you before you say you're choosy about who is going to take care of you. And with the fact that we've mentioned earlier, there are even scarcity of these doctors. So you have to get the one that's available. So these are all part of the things that could help. Then of course increasing awareness, going to the community, giving some talks, going and involving other members of the community to make sure that you dispel all these myths and misconceptions.
Talking about talks, I want to ask what is going wrong. I'm speaking from experience. You know, many years ago when I had to use antenatal facility for the first time, and when I used it the last time, there was a huge difference in this talking you're talking about. I mean, the first time, you know, the midwives, the nurses were excited about antenatal. They were given the right information. They had the time. They were patient. Is it that the economy or something has changed? I want, because these days, I mean, you walk into antenatal, there's no energy. Those days, women are excited to come for antenatal. There's no energy anymore. There's no, I mean, the talks, even if away from maternal, whatever, if you go for immunizations now, they don't, I mean, nobody's educating anybody about anything. Nobody's willing to talk. They don't have the energy. They just tell you, I can't shout. You know, the midwives just come and tell you, you know, I don't have the energy, I can't shout. And then they just go on and do what they have to do. What is changing? Is it that there's no more interest in this, or there are other factors that is, you know, affecting all of this?
So when you talk about interest, I mean, there are a lot of interest, because if you're a medical personnel, you take oath. So there are a lot of interest. A lot of people work with the fact that they like what they're doing. However, there is a lot of stress and strain. There is a lot of lack of manpower. By the time you know you're going to attend to 50 babies or 50 women, and you know you're going to do it within a short period of time, you might think you don't need to use a lot of time talking to these women. You better start seeing these patients almost immediately. But I'm so sorry, I don't know where you went to. They still give health talks. You understand? It might not be as detailed, as
explanatory,
exactly,
as interesting.
Yeah, it might be, but then maybe for within a short period of time. You understand? But then, of course, it all goes there because just as you're saying, yesterday I was in the clinic and our nurse was saying there was supposed to be like 5 nurses in the clinic, but she was the only one in the clinic, overseeing almost 50 patients. So something of 5 nurses, so say maybe 1 nurse to 10. So now she's doing for 50. So you can imagine, she's human. So she was overstretched. She was really trying, and the doctors were helping her, but she would not have that same energy. She had to take care of 10 people, maybe someone doing urinalysis and she giving the health talk, and the work is going. Of course, you can't keep the patients waiting. Pregnant women, think of it, keeping you to wait for 2 hours, saying you're just going to have a health talk before you see the doctor is also another problem. So to be candid, really lack of manpower.
Well, on a lighter note, perhaps, you know, when on your first ever trip, it seems a bit more interesting. When you go that route over and over, it becomes less interesting. I guess that's the experience you already had. But let's talk technology. Now, technology is changing healthcare globally. So how much of it can we latch onto to improve maternal health care in Nigeria?
Thanks so much, because that question is really a wonderful question. Because if we want to get it right in Nigeria, we must bring in technology. First and foremost, we are talking of how to educate women. We are all carrying a mobile phone. Mobile phone is the commonest thing. Even a very poor woman of my market, if you ask of her number, she will put her hand inside and bring it. So that's one area we can use as a mode of advocacy. Because as I told you before, because of the nature and holistic nature of our maternal mortality, we always like to start from the basis. So when we bring in that, we can educate them. We can tell them. Most of them are not there to listen to what we are saying. But simple SMS can talk to them in different languages. You can use it to educate them. Even the issue of religious factor we've not mentioned. I hope you know that they listen to their pastors, their imams more than us. And unfortunately, some religious houses, they've turned their areas to mini clinic. That's what technology, awareness of information can help us. Then we come to the hospital. Our primary healthcare centers, can we boast of ultrasound? Then in event of emergency, you can put a probe and now know whether to refer her immediately or not. In our major centers, can we talk of our theater being available? The equipment there, are they available? We are talking of resuscitation like the woman you mentioned, I wasn't there. But some equipment can resuscitate her immediately. Now, I have to talk of, still under that infrastructure you mentioned, our blood bank. If we want to reduce our maternal mortality, we must look again towards our blood bank. Availability of blood and blood products. Postpartum hemorrhage is still the leading cause of direct cause of maternal mortality we have. What of the infrastructure in our blood bank? Are they available? Our various tertiary centers, are they equipped to handle emergencies? Let me tell you from the clinical aspect of it.
So you mean even tertiary centers are not equipped enough?
Oh, they're not equipped enough. We need our equipment. Like she mentioned earlier, this maternal health, maternal mortality we're talking about. In Nigeria, we're talking above 1,000. In fact, some centers, like I studied in Lagos, recorded above 2,000 per 100,000 live birth. But in developed countries, they are talking of less than 10. So even in our tertiary institutions, we're still deficient. We need to start from the grassroots, in our infrastructural development, through primary health care, through our referral system. That's another area. The woman you mentioned, she died because I don't want to talk around what happened within the hospital, but I'm sure if that woman was being transferred by an ambulance, she wouldn't have given up. Because inside the ambulance, she will be given oxygen, she will be given drip, the hypovolemic shock that took her will be controlled. So she will be there breathing till she'll be able to get an assistant.
And that's why I'm asking, what about telemedicine? What about mobile health services? Not just ambulance.
Okay, now we'll move towards the end, because when we mention telemedicine, we mention availability of internet, because we are not talking about the health of we women in Abuja. We are talking about the health of Nigerian women. So at the apex of it all, we now mention the telemedicine, where I am sitting in here, right here in Abuja, and I'm helping a certified midwife working down in the primary health care center. I can treat the woman, I can tell the woman what to do. So telemedicine is a very important aspect, but we have to be aware that we don't have internet all over. And when we want to measure our maternal mortality rate or ratio, we are talking of Nigeria as a country. So from infrastructure, telemedicine, we have a lot to do before we want
All right. Dr. Ahmed, I understand that you have some other pressing engagements and you may be leaving us shortly. So I'd just like to hear your view, before you go, what you think are some of the strategies we should adopt in dealing with maternal mortality in maternal health in Nigeria.
Okay. Thank you very much for that. So some of the strategies that we should adopt in dealing with maternal health in Nigeria to prevent maternal morbidity and mortality is, first of all, nutrition. We need to make sure that our girl child are well nourished, so that they are well developed, their pelvis is well developed, and this will curb all the complications that are likely to occur as a result of an undeveloped or poorly developed pelvis. Another thing that we need to take care of is poverty. Poverty eradication is also very important. This can be done by empowering our women empowerment, and then also girl child education. Then also all these cultural taboos, harmful cultural practices, as much as possible should be avoided. How do we do that? We go for outreaches. We go to the community. We educate them. We teach them. We tell them what to do and what not to do. And then having skilled birth attendant, it's very important. And then when we talk about skilled birth attendant, because as much as we want these women from the community to come to town and have access, it's not possible. So can we take these services to them? Yes, we can. There's still some people that will never come to the doctor in the hospital to see. So that particular traditional birth attendant that's taking care of her, why can't we educate that traditional birth attendant to make her a skilled birth attendant? So that is also another way. Those TBAs should be trained. Those community health extension workers should be trained. Training to take care of the delivery, training to identify danger signs, and training to refer as soon as possible. Those are ways that we can also take care of it. Then also strengthening our antenatal care services, making sure that antenatal care, it is given properly and it is done well. Then another thing that could also be done is respectful maternity care. This is something that's been advocated by the World Health Organization. Respect, because of course, if a woman goes to the healthcare facility, she's abused. She's not taken care of. She's not respected. Nobody would go back there. But by the time you go to the healthcare facility, you're being taken care of. You're being respected. That would help you and would help your mental health. Because also mental health is another problem that's happening. Before you know it, this woman comes with postpartum depression. So respectful maternity care, taking care of their mental health, it's also very important, including the postnatal follow-up. Make sure that these women are educated and they're given tips on how to take care of themselves as well as their babies. And then lastly, male involvement, the male partner. As much as possible, when we see our patient, we tell them, Oga will not follow you, male involvement, because so that they know what is going on and they also give this women support. So male involvement, families involvement, and communities involvement, because as I've mentioned, sometimes it's even just to make the decision that they might need an elder person in the community to make that decision. But by the time you involve that elder person and inform him about the importance of bringing the patient early or allowing the patient to go to the hospital, that are all some form of strategies that can be undertaken to curb this menace of our maternal morbidity and mortality, which unfortunately it's a preventable condition, but sadly it is with us.
All right, Dr. Mahmoud Rabi Ahmed, consultant obstetrician and gynecologist. We'd like to thank you very much for your time. And since we understand you have to leave us for some other engagements, we thank you very much, and we hope we'll see you some other time.
Thank you.
So Good Morning Nigeria continues after this very break. Please don't go away.
Well, creativity is so broad. I would say whatever it is that you're creative about, it takes a lot of practice before you become very good. So if it's something you intend to pursue, it's something you have to keep doing. You have to keep practicing. It's not going to be an overnight success, which a lot of people look for. But if it's something you're determined about, but the drawback rather, is that you need what is called staying power. While you're developing your creativity, you need to earn a living. So I know that's where the conflict usually comes in, especially with the hardship in the country and all that. But I think a lot of encouragement from the private sector to create incubator hubs. We've had some of those in tech. We need those across various sectors as well. Incubator hubs where these ideas can come in, be developed, be encouraged, be funded, and then we can expand it from there.
Content creation, while it may sometimes get a bad rap, I think it's actually very important because we have to see ourselves. We have to see ourselves living our lives. We have to show and share our stories. I think that's very important. Now, the job after that is to be able to digitize those stories into something that can provide data and insights, that can ensure that we can be able to support whole-scale industry in these spaces, to ensure that the amount of money that each content creator is getting exceeds what is currently happening for many content creators. The same content creator who lives in Nigeria will be earning less than a content creator who's living in the US or the UK or Japan. And we've got to also bridge that gap, because most of that is being driven by the ability of the consumers to pay for those goods, and also the pricing that many of these platforms have. So I think this is not the job for the content creators and the young people. This is a job for people like myself in the ecosystem who can help support the right pricing, to advocate for the right policies, to support economic development for consumers who want to consume that information and that content. And even beyond content creation, we're seeing that many people are stepping in behind the camera. They are producers, editorial, they are graphic designers, they are in technology, but maybe not in front of the camera. And what we want to say is also, we need those people too. We need those stakeholders involved. And the job of many policymakers, DFIs, is to ensure that the strategic investments get there, the collaboration gets there, and we're deliberate in how we're saying we want to support innovation in our continent.
There's an age group where your brain function is at its maximum, and that's the age group we call the youth, isn't it? So we need the youth, the younger generation, who have the energy, the imagination to be equipped with the proper education, the proper tools, the proper encouragement. and then take what innovation they bring out and turn it into mainstream developmental ideas. So you find a lot of things that are invented by people in school or straight out of school. We need our patent laws to work so that they can earn a living from their imagination. Once the imagination is just for a one-year festival or an event, then it's not worth it. Somebody creates something, we need to get our patent laws to work, we need to enforce them, and then the private sector can use those patents to develop things and encourage more people to be more creative. Back in the days, yes, you had to be an engineer, a lawyer, a doctor. Today we have programmers, we have AI specialists, we have people that are doing ethics on genetics. Those things didn't exist 50 years ago. So there are new areas that need to be explored. The question really, apart from the parenting, does our educational curriculum cater for what the needs of the world will be in the next generation? Because our curriculum is dealing with the issues of the past. We need the government and the private sector to redo the entire educational curriculum to be forward-focused, not retroactive.
This Sunday, live on Sporty TV, Atalanta.
Villanova with the corner, and better Jim City.
Bologna.
Good deep ball look for Orsolini. Oh, what a terrific strike.
Atalanta versus Bologna, live on Sporty TV.
Brought to you by SportyBet. Play with champions.
All right, many thanks for staying with us. We are still discussing maternal health and well-being on Good Morning Nigeria. And a lot of issues have been raised and some solutions. But let me go to Onyedikachi in Port Harcourt as we are talking solutions now. And I'm asking, do you see a role for families and communities in delivering safer maternal health care, safer motherhood in Nigeria and communities particularly?
Thank you. Before I respond to that, let me quickly touch on digital health technology. You mentioned telemedicine, and there are proven solutions that are currently being implemented. I'll give two examples. There's the Complete Health app. This is a virtual self-care support app that provides women with information on prompts when to visit the health facility, monitors their weight, blood pressure, gives them real-time feedback on when they need to access in-person care for those times they are outside the health facility. And this is something that uses low internet connectivity, almost similar to the USSD device that we use on our mobile gadgets. There is also the Navi Health platform. This is another digital health platform that now collects women's voices. When I say women's voices, women's experience. We've talked a lot about women's experience when they visit the healthcare, the need for respectful care from healthcare providers, because these are the things that would shape whether the woman is going to come back to that health facility, or the attitude of the provider will actually determine that. So in designing programs, in making decisions, in signing policies for women's health, it's important to put into consideration women's voices, women's experience during childbirth, during delivery, postpartum period, because women's experience and using this feedback is critical in quality improvement. We've talked about, different pillars of quality this morning, from the attitude of the health worker to the presence of critical infrastructure that will provide quality care. So women's voices is another part of it. So Navi Health does this by giving the women the platform to provide feedback on the kind of care that they receive. And this is collated into improving quality in respective health facilities, in respective health workers, finding the gaps that this health worker require training and all of that. So these things are already proven to work. They already exist. However, they need to be scaled so that more women in underserved regions can have access and begin to use this digital technology to enhance their healthcare service provision, because it's a whole opportunity, a whole world of opportunity existing there for digital health technology. Now, talking about the role of families and communities, it's very critical. Cannot isolate the role of families and communities in improving maternal health care. Every Nigerian, as a matter of fact, should be informed, because maternal health is not just women's business. Neither is it the business only of those in the media or those in the health sector. It is everybody's business. We all have mothers, we all have sisters, we all people have wives who we are talking about, because when we talk about maternal mortality, it just sounds like a very far number. If Nigerians, to bring it home and tell us how critical these figures are, once you close your eye to think of women dying in Nigeria, every Nigerian knows at least one woman who has died from giving birth in Nigeria. So the numbers are, the figures are staggering. So people, families, communities should be aware of the state of maternal health, the state of maternal mortality in Nigeria, and provide that concerted effort. There's something we do in Nigeria Health Watch, where we pull together stakeholders and individuals from across various sectors in Nigeria, from health, education, the arts, the different sectors beyond the health sector, to talk about maternal health through an art gala. We just concluded the last one during the International Women's Month on the last Friday of March, where we put together various stakeholders to talk about maternal health, now using art, because some people would never know about maternal health except you are innovative in providing these awareness. We call the event the Celebrating Womanhood Art Gala, and we used various forms of art to buttress the maternal health issues in Nigeria and prefer recommendations that can be used by families, communities, individuals, policymakers, very, very critical to improve maternal health in Nigeria. We used exhibited artwork.
Many thanks, Onyedikachi. Great work you're doing at the Nigeria Health Watch there, and of course,
is a voice.
Many thanks, Onyedikachi. Thank you for your comments. Because of time, we need to run, but great initiative there by the Nigeria Health Watch. I'd like to get back here to Dr. Umuemo. Yes, as we round up the conversation, being a consultant yourself and you've seen it all, I mean, to a point, what kind of policies and programs would you like to see, really, that you think would have a positive impact on maternal health and, of course, reduce mortality?
Thank you so much for the question. The first one I must go to, due to, like she mentioned, the MIMI project, there are a lot of things happening now under our president, especially the MIMI project that came up, the issue of cesarean section for indigent patients. But you have to get it right. We have to look at antenatal. The first policy I will love government to start with is to make antenatal care free. It's good to make cesarean section free or to assist indigent patients. But we have to know that some of the complications that are leading to the cesarean section is due to poor management during antenatal care. If we get antenatal care right, we will reduce also our rate of cesarean section and the accompanying maternal mortality and morbidity associated with it. When we make antenatal care, antenatal care period free, we will be able to use advocacy to bring in women, because though we're making it free, we have to bring in advocacy so that our women will come and book for antenatal. So our women will be taken care by certified skilled birth attendants. If we start from there, we know we're starting and we're getting towards where we want to be. The second aspect is a primary health care center. Maybe because I've been working in communities, I also have a foundation. If we cover a primary health care center as well, it will reduce most of the morbidity and mortality we're dealing with. Let us try as much as possible to ensure that at least we have a doctor or two for each primary health care center. Because if we have them, there are decisions doctors are supposed to do. When they work with our trained midwives at the primary health care centers, you will see we will reduce most of this morbidity and mortality we're talking about. Then another important aspect, because we've been talking of pregnancy, we also have to talk of before pregnancy or after pregnancy, our family planning. We have to revisit our family planning. Because remember, if you go to World Health Organization of definition of maternal mortality rate, it's not only associated with term pregnancy. It said any woman, if you lose a woman while pregnant, irrespective of the duration of that pregnancy or the site of that pregnancy, during that pregnancy time or within 42 days after the end of the pregnancy, due to causes related to aggravated by pregnancy or its complication. Why am I trying to define it? When we're talking of maternal mortality, we must remember unsafe abortion. We have a lot of quacks in Nigeria. I've heard of one case, a young lady that went to procure abortion, and the man used bicycle spoke on her, went through the uterus, entered the abdomen, got the gut, that is the intestine, and brought it out through the vagina.
Oh my God.
So we need firm policies and regulations towards that. Then we need free availability of family planning products so that a woman can plan her family. If we plan the family, we will prevent unwanted pregnancies, unsafe abortions, thereby reducing maternal mortality. Then, as we've spoken previously, the issue of infrastructures in our hospitals, be it the primary, the secondary, the tertiary institutions. We need to look at our infrastructures.
Okay. Thank you.
But
Thank you.
maybe we should also mention that this present administration has approved the construction of 8,800 primary healthcare centers. That's a good initiative, and we hope that they can see it to the end. It would do a lot of good. You're talking about primary healthcare centers being accessible to the average Nigerian woman in rural communities.
Frankly, I have to also chip in small because it's unfortunate we Nigerians, we speak a lot about the negatives. Yes, we are suffering in Nigeria, but I also have to mention the positive we are seeing with this current government. I'm beginning to see a holistic approach.
Increasing the budget for health, for example?
Oh, yes. I attended a meeting where I complained that in the whole of Nigeria, we don't have a single PET scan in any government hospital in Nigeria. And they told me they've already approved that this year. So I think we're doing a lot. If we continue with this trajectory, we'll be able to achieve a lot. But I hope we'll be able to sustain it.
All right, thank you, Dr. Umakwe. Let's get to Onyedikachi again. Onyedikachi, I'm asking, how much impact do awareness campaigns and storytelling actually have on reducing maternal mortality or changing behavior, in your opinion?
Yeah, storytelling. Talking about storytelling, that's what we do at Nigeria Health Watch. So one of our key strategies for advocating and communicating health, providing that informed health commentary to citizens of Nigeria is through storytelling. And we do this through weekly editorials. If you visit our website, www.nigeriahealthwatch.com, you would access a wide range of information on various health subjects and maternal health as well. So the role of storytelling is critical, and we engage with stakeholders, we engage with beneficiaries of various interventions to get hands-on information, not just information that we assume. We go to the grassroots, conduct interviews from healthcare providers, implementing partners development organizations that are championing causes around maternal health care improvement. So yes, providing information through storytelling is very important, and these stories are things that people can now relate with and be able to gradually change behavior, because in behavior change, it's not rocket science. It's not a switch where you just get the information today and people are changing their behavior tomorrow. And that's why these conversations have to be sustained, because there's the awareness, and then there's the interest. Then there is this individual contemplating to adopt a new behavior. And
Onyedikachi, you mentioned information, and that gladdens me. I just want you to take 30 seconds to tell us, because data is critical. Are we doing enough to use data, to track what happens and deploy to determine health outcomes when it comes to maternal mortality? Thirty seconds.
There's still a whole lot of work that is required to be done in terms of using data. Yes, there is the MPDSR, maternal and perinatal death surveillance response, which is an initiative or a quality improvement system that tracks the causes of maternal deaths in Nigeria, reports them real time, so that this reporting can be used to make decisions for quality improvement. However, this is still evolving at various state level, and it needs to be strengthened, it needs to be scaled, it needs to be funded, so that implementers, healthcare providers, and every stakeholder in the maternal health space do not have to reinvent the wheels. If we know that postpartum hemorrhage, which is excessive bleeding after delivery, is the leading cause of maternal deaths in Nigeria, then there should be prompt and proactive measures, which are already put in place. But what I want to emphasize is that, yes, these measures are there, but they need to be scaled and they need to be sustained.
Thanks, Oyedikachi. Because of time, we need to round off. Dr. Maureen Mwemo, I'd like you to, speak to women in general, and of course, speak to religious leaders and traditional rulers. Some of their messages, of course, are, not affecting, or rather not helping in all of these issues. Your final words as you address that.
Thank you so much. My final word to our women. I have to tell all women in Nigeria, and even globally, their life is in their hands. They have to protect their lives. They have to do the necessary things they're supposed to do so that they will live and enjoy the fruit of their labor.
10 seconds more.
For our traditional rulers and our religious rulers, I have to plead with them. They are not doctors. They are to encourage and educate members. The pastors keeping our pregnant women in their various centers as a mini clinic should please educate and assist them and bring them where a certified, trained, skilled attendant will take care of them.
All right.
Let's work together in Nigeria to reduce this embarrassing rate of maternal mortality. Developed countries are mentioning 10 in 100,000. We're still above 1,000, except the recent one I just came in. And if you go to other centers, we are talking of recorded maternal death. Go to other centers. Some are recording above 2,000.
All right. Many thanks, Dr. Murray. We need to round off the conversation because of time. You have made so many valid points, and we hope that we'll begin to see a change in all of this. Thank you very much, Dr. Maureen Umwemo.
Ako Ewulu. It's a simple name.
President-elect Medical Women Association of Nigeria, FCT, and consultant obstetrician and gynecologist at the National Hospital. But it was a pleasure to have you. Thank you so much for your insights. And of course, we appreciate Oyedikachi Ewe, Senior Program Lead at Nigeria Health Watch. Thank you so much for your time. And of course, we do appreciate Dr. Ahmed, who joined us much earlier. So that's good morning, Nigeria today. Thank you so much for watching. We hope that we'll see a change. And to all those wanting to be like Hebrew women, you are a Nigerian woman. What is important is that you're alive and your baby is alive. I'm Yen Ray John.
And I am Victor Azu. See you again on Monday. Bye-bye.